there, this is Kira Leslie with Debunking Addiction for HealthyPlace.com, and today I want to talk a little bit about dual diagnosis. Dual diagnosis is also sometimes called co-occurring disorders, and it just means that a person has addiction issues in addition to having mental health issues. And I've been thinking about it recently. I'm dual diagnosis, and I know a lot of people who are. In fact, I would wager a guess that it's probably the majority of people who have addiction issues, although it's not always diagnosed. At any rate, it's a very high percentage, and a very close friend of mine has been struggling with maintaining sobriety and told me that every time she's able to achieve a certain amount of sobriety, the mental health issues and the symptoms keep leading her back to abusing substances. And this is something that happens again and again and again for a lot of people. And I know when I was struggling to get clean and sober, I got a lot of different advice from professionals, some of whom insisted that you have to treat the addiction before you can treat the mental illness, because there's no point in trying to address the mental illness if you are still putting these substances into your body and abusing them so heavily. Then at the same time, I also knew people, professionals, who said, no, you have to treat the mental illness or else you'll keep going back to using and drinking, and at the same time, if you treat the mental illness, you may even find that you no longer have a drinking problem. Well, that I don't think is true. But both of those opinions have truth to them, but they're also both not the full story. And the reason for that is that you have to treat both the addiction and the mental health disorder simultaneously. At least that has been my experience. And when I was first getting sober, there were a lot of different things involved. There was no magic bullet, but I was doing intensive outpatient. I was heavily involved with 12-step programs, and at the same time, I also started taking a medication that I think, in retrospect, was very helpful for me. Unfortunately, there really is a lack of adequate facilities and support for people with dual diagnosis, especially if you don't have private insurance and have public health insurance. Then waiting lists are extremely long in every state. Some states are better than others, and dual diagnosis facilities in particular are lacking from what they should be and from what the need really is for them. So I guess this is my plug for treating both the addiction and the mental illness of dual diagnosis at the same time, and also my plug for the importance of expanding access and availability of treatment for everyone who has dual diagnosis. And I would like to hear other people's experiences with dual diagnosis and treatment, and so please go ahead and share below.